exactly is birth asphyxia? Birth asphyxia simply means that a baby does not get enough oxygen before, during, or after birth. So when the baby does not get enough oxygen in each of the stages here, before, which can be the pre, during, which can be the intra, and then right after birth, which can be the post, it can lead to birth asphyxia. And so it goes with the other name, perinatal asphyxia. As we know that peri means around the 10. That's why we have perioperative care, which includes the pre-operative care, the intraoperative care, and then the post-operative care. So without oxygen, we know that the brain and other organs like the liver, the heart, the kidneys, and also even the liver can be damaged. That is why some babies are born very weak. Some do not cry immediately. Others also struggle to breathe. What causes this condition? There are several causes or several things that can stop a baby from getting enough oxygen. These are self-explanatory, so I'm not going to explain them. We have prolonged labor or difficult labor. When there is prolonged labor, it can result in birth asphyxia. We have umbilical cord problems like a cord being wrapped around the neck. And also, when the mother experiences severe bleeding, we know blood carries oxygen to the brain, which needs to perfuse the brain. And so, when there is severe bleeding in the mother, it can also affect the neonate. Right. And also, we have maternal health issues such as high blood pressure, infections, or diabetes. These conditions can also lead to inadequate oxygen supply to the baby or the neonate, either before birth, during birth, or just after birth. So, how can we tell if a baby has birth asphyxia? These are some of the common signs that can show that a baby has birth asphyxia. One is that the baby is not breathing or breathing very weakly. So when the baby is not breathing or breathing very weakly, we can suspect birth asphyxia. A low heart rate, usually below 100 beats per minute. Sometimes you can even record 0 beats per minute, right? When you record anything less than 100, expect asphyxia. And also we have a floppy body instead of strong muscle skin. We have something called hypothermia, right? You have weak muscle tone. And also poor reflexes like the sucking and also grasping. Because the baby is not receiving enough oxygen, they are not active, right? And also their skin look bluish and also very pale due to inadequate oxygen supply. So what should be done immediately at birth when a baby is suspected to have birth asphyxia? We have to know that the faster we act, the better the chances of the survival of this baby without any serious brain damage. Because the more you wait, the more the brain cells get damaged. And 95% of neonates who usually survive this condition usually go with burden. They become a burden on their family or their parent. And the kind of burden they brings to their family or their parent depends on the part of the lobe of brain that gets to destroyed or that gets injured. So when the frontal lobe is destroyed, the baby will have problem with the speech, thinking. When the occipital lobe is destroyed, their vision will be affected. They can become blind. When their temporal lobe is injured, the baby will not be able to hear. So it depends on the part of brain, the lobe of brain, the section of the brain which gets injured. And so as you wait for longer, the more the brain cells swells up and then it gets destroyed. So some of the actions that should be done immediately after a baby is suspected to have birth asphyxia is first, we clear the baby's airway. Is either we make sure that any fluid in the nose, the mouth, they are all being suctioned, right? And then we stimulate gently to encourage breathing. If there is no improvement, we use bag and mask for ventilation, and also keep monitoring the baby's heart rate and breathing temperature. Because neonates with this condition, they can come in 1 minute, you can see that they have like an excellent vitals, and the next second it will fluctuate just like that. So they need constant monitoring. Yes. So what happens when the baby has already be suspected to have brain injury? We have something we call head cooling or therapeutic hypothermia. That's where this term comes in, and we use this method or this procedure to reduce the baby's body temperature to about 33 to 34 degrees Celsius for 72 hours. That is 3 days, using the cooling cap or the mattress. All right. So when this cooling happens, it makes sure that it slows down the brain cell damage, right? Because it reduces the swelling, it reduces the metabolic activities of the brain, thereby reducing the swelling and gives the brain the chance to heal. Some of the cells can regenerate, but some of the cells cannot regenerate. So the cells that can regenerate, we give it chance to heal and generate. But we know that the nerve cells cannot regenerate. So after 3 days, the baby is slowly warmed back to its normal body temperature. This is usually done at the intensive neonatal care unit, and not all hospitals in Ghana have these technologies that can be used to monitor. All right, so let's get a quick recap. We said birth asphyxia is whereby the baby does not get enough oxygen at or around birth. We said some of the causes include difficult labor, cord issues, bleeding, and maternal health problems. We said some of the signs that shows that a baby has birth asphyxia is weak breathing, low heart rate, floppy tongue, poor reflexes, bluish skin, and immediate resuscitation is critical in this situation in order to save the baby and also increases its chances of survival. We said head cooling reduces brain damage and is done in NICUs with special equipment. This brings us to the end of our lesson on birth asphyxia and head cooling.